Hi, I'm Dr. Carter. I understand you've been feeling quite unwell. Could you please confirm your name and date of birth for me?
Sure, it's Alex, and my birthday is the 12th of May.
Great, thank you, Alex. Today, I'd like to talk with you about your symptoms and explain a bit about viruses, especially as it relates to your throat infection. Is it all right if we proceed?
Yeah, that's fine. I'm really hoping to get some medicine to help my sore throat and that nasty cough. I've even been sucking on tons of throat sweets.
I understand you're feeling very uncomfortable. Let's go over your symptoms first. You mentioned a really sore throat that hurts when you talk, swallow, or cough, and you've also had a dry, irritating cough. You're also feeling generally under the weather, but you haven't had a fever. I checked your throat, and while your tonsils are a bit red and slightly enlarged, there's no pus or exudate. Also, I didn't find any tender lymph nodes in your neck, correct?
That's right. I've looked in the mirror a few times and my tonsils seem a bit swollen, but there aren't any white spots. I was even told yesterday by another doctor that it might be a virus.
Exactly. It sounds like your symptoms fit more with a viral infection rather than a bacterial one. I'm aware you're keen to try antibiotics. Could you share a bit about why you feel that way?
I really want something to knock this off quickly. I thought antibiotics would help me get better faster since I'm having so much trouble eating and drinking.
That makes a lot of sense, especially when you're feeling so miserable. Let me explain a little more. A virus is a type of bug that can cause infections like the common cold, flu, or even COVID-19. Unlike bacteria, which cause infections like strep throat or some food poisonings, viruses are different in structure. Antibiotics work by killing bacteria, but they aren't effective against viruses. This is why we usually manage viral infections with supportive care like rest, fluids, and painkillers, rather than with antibiotics.
Have you heard much about viruses before today?
I know they're the bugs that cause things like COVID-19, but I'm not really sure how they work.
Right. Viruses enter your body and use your cells to reproduce. Unlike bacteria, your immune system has to fight them off without the help of antibiotics. That's why, even though you might feel pretty terrible for a week or so, most viral infections eventually resolve on their own.
So, because my tonsillitis is likely caused by a virus, antibiotics wouldn't actually help me get better.
Exactly. Antibiotics are only effective against bacteria. In cases like yours, where the signs, such as the absence of a fever, pus on the tonsils, and tender lymph nodes, point towards a viral cause, using antibiotics wouldn't be beneficial and could contribute to antibiotic resistance.
But I've also heard about tonsillectomies. If I'm always going to get this virus, shouldn't I have my tonsils removed?
It's understandable to be worried about recurring throat infections. However, tonsillectomy, surgical removal of the tonsils, is generally reserved for patients who experience severe or very frequent bouts of tonsillitis. For most people with a viral infection like yours, the symptoms eventually resolve with time and supportive care. Having your tonsils removed isn't a guarantee that you won't get throat infections in the future, and in many cases, the risks of surgery outweigh the benefits unless your episodes are truly recurrent and debilitating.
So, just to be clear, my tonsillitis is viral, and even though I feel awful now, I'm not necessarily going to have it over and over again unless I have surgery.
You've got the idea. With viral tonsillitis, the episode you're experiencing will pass as your immune system takes care of the virus. While it's possible to have more viral infections in the future, since viruses are common, most people only get them occasionally. The decision to remove your tonsils is usually based on how often and how severely you're affected, not just this single episode.
Could you summarise back to me what we've talked about today? Just so I'm sure we're on the same page.
Okay, so my symptoms suggest that my tonsillitis is caused by a virus. A virus is a bug that makes you sick by taking over your cells. And it's different from bacteria. Antibiotics only work on bacteria, not viruses, so they wouldn't help me recover any faster. Also, while I've been worried that I'll keep getting tonsillitis unless I get my tonsils removed, that's not necessarily the case. Tonsillectomy is only considered if the infections are really severe or happen frequently. Is that right?
Exactly right, Alex. You've understood the key points very well. I know it can be frustrating feeling unwell without a quick fix like antibiotics, but your body's working hard to fight off the virus. I'd recommend supportive measures. Make sure you rest, drink plenty of fluids, and consider over-the-counter pain relievers to manage the discomfort. Do you have any questions or concerns about what we discussed?
Not at the moment. I guess I just wish there was a quick fix, but I understand now why antibiotics wouldn't help.
I appreciate your concern. It's normal to want to feel better quickly, but sometimes the best treatment is simply giving your body time to heal. I'm also happy to provide you with some information leaflets and website resources so you can learn more about viral infections and when tonsillectomy might be considered. Remember, if your symptoms worsen or you develop new symptoms like a high fever or difficulty breathing, please don't hesitate to come back.
Thanks, Dr. Carter. That really clears things up.
You're welcome, Alex. I'm here if you have any further questions. Let's schedule a follow-up if you feel like you're not improving in the next few days.